it's a fact that, people may be having some kind of problems while it comes to, being fertile and being able to conceive, being able to, have good days in pregnancy. And that very initial hiccups that come before they conceive probably actually take a lot of toll on a good number of couples. So here, it's not all about exactly eating the right thing when it is pregnancy time, but it is to prepare for pregnancy. Also, we need to, make sure that our body is well ready to accept and well ready to, nurture the growing life which happens during pregnancy. So while we look at it, and while these couples may also be speaking to their gynecologists to understand, how to make their body ready towards becoming pregnant, the gynec would definitely refer and tell them to conceive. I mean, to be able to, start on folic acid supplementation. However, whatever said and done, it's not all about taking one medicine to make things happen for you, right? There is a lot that goes around making yourself. First thing is happy, to think around that you want to get pregnant, right? That's the very first thing. If you start with the thought कि नहीं हो रहा है, means it's a worry, right? So ये हो जाएगा, ये सोच के if we start, then that automatically brings around more joy while you are, engaging with each other. So trying to, play around, bringing in those happy hormones at the very start takes and makes your body, respond better when it comes to fertility. Right.
So can you just define, just define what is exactly fertility nutrition means?
Yeah. So, when we talk of fertility nutrition, it's all about eating right and thinking right in a way that it creates an atmosphere that your body prepares towards being fertile, right? So when I talk of food, of course, we should not definitely miss the micronutrients and the macronutrients. So we definitely do not want to miss the minerals and vitamins, which are going to be very necessary. And we don't want to also, lose out on the right weight gain during pregnancy. So preparing towards that also is necessary. Imagine if I'm, say, 10 kgs or 15 kgs obese while I'm trying to conceive. So, my body is not prepared to take that additional weight, which any which ways is going to come during pregnancy. So right now, when I talk of fertility nutrition, I should try and make sure that I am in the right weight, the normal weight to conceive. Imagine if I start at 75 kgs or 80 kgs weight and I get pregnant, I will definitely add another 10 kgs during pregnancy. It can become difficult for me, right? I mean, carrying that 90 kgs to term sometimes is really challenging. But that means that while I'm looking at fertility nutrition, I'm not trying to do a weight loss program. What I'm trying to do is try to correct my eating ways such that my body gets the right nutrients, which allows my womb to be prepared to receive the embryo and to be able to get that embryo embedded in the uterine wall such that the pregnancy can start. So, it is important to have those particular micronutrients, which probably definitely include the folic acid.
So can you tell me, you are talking about micronutrient and macronutrient. So as a doctor, I can understand what you are saying, but can you explain in layman language what exactly those micronutrient and macronutrient and how people should understand it in a easy way?
So let me start with micronutrients, because initially these micronutrients make a huge benefit and they have a huge role to play. Micro means a little amount, right? When we say micro means, its ideal meaning is small or little. So while we are looking at this, what we require is in little amounts, but those are several other nutrients which include your vitamins and your minerals. So when I say vitamins, what I require is vitamin A, I need vitamin D, I need also vitamin C and B complex, so many more. And I am also interested in having a good quantity of vitamin K as well, so that my blood remains well. There is no unnecessary clotting, etc. that happens. So all of these has to be, taken in the right proportion, because I can't eat vitamin K. So there is no food which will say ye kha lo aur vitamin K mil jayega. It is going to be created in the body. But when I'm looking at other nutrients or other vitamins, I am able to eat foods which are rich in vitamin A. I'm able to take some foods which are also fortified with vitamin A and vitamin D, because we've seen so much of vitamin D problems that have come. So many members, so many women are found vitamin D deficient these days. And the pandemic has made us sit at home. We have not been exposed to sunlight also as much, which is the best source of creating or generating vitamin D in the body. So not just eating the right vitamins, but also making sure that it is absorbed well and it is utilized in the body, such that your body prepares and becomes healthy towards uh, I mean, brings around that fertile change in your cell. Okay. When I'm talking of not just vitamins, I'm also wanting the minerals to be right, right? So minerals would include your iron, your calcium, magnesium, selenium. These are the ones which are going to be important when it comes to having, healthy pregnancy. So if my body is deficient in those, and if I'm trying to make, or rather prepare myself towards pregnancy, then these are the ones which I have to ensure that are coming from my food. If not coming from the food in adequate proportions, then maybe also, speaking to the gynecologist to give you a supplementation for the same. The supplement may not be in huge portions and continue for a long length of time, but initial, when you go and check your body, and if these nutrients are less, somewhere your body is not ready to conceive. So trying to prepare the, what you say, foundation for pregnancy is important, and that's what we call as fertility, right? Your
So, which kind of food? Like you said, this vitamin, like you said, vitamin D is a sun exposure. We get this vitamin D. So, all other vitamin which you said here, or the minerals, in which food easily can be found, and how we can choose those food to in order to receive this vitamin and minerals.
correct. So, nature is benevolent, and nature has, bountiful food that is is available. So we are able to choose, smaller proportions from a variety of foods. When I'm looking at B complex, or when I'm looking at those particular vitamins coming in, I can choose from cereal grains, pulses, and I'm also able to choose from fiber-rich foods coming from vegetables. When I'm looking at vitamins which are, I mean, from the colored fruits and colored vegetables, I'm able to get a huge number of micronutrients, which are maybe iron, they are calcium. I'm also able to get anthocyanin based foods which are going to create a difference in my body. I'm able to consume citrus fruits, which include your oranges, pineapples, maybe even green chilies, avla, which
Guava,
is going to
guava,
hugely
amla,
available.
yeah.
Yeah, is going to be hugely available now. The season is turning into winter. We'll have a lot of leafy greens which will be available. So all of these are going to create, I mean, are going to allow you to eat the right kinds of food and make sure that all these vitamins, minerals are available to your body. Right? It's not that, by eating one bunch of palak, you will get so much iron. But however, if I need, say, 40 grams of iron in a daily day basis, that 40 grams will require at least four bunches or maybe more of palak to get that quantity. So, always it's not all about how much of one particular food you will eat, but it is wise to have a combination of items to create the required daily allowance which we need to meet in terms of nutrient values.
Okay. And what about folic acid? Where is the folic acid? Because I know that there are so many women who wants to conceive. They have been given that folate tablet. So, what is the role of folic acid and where it fits in? Is it micronutrient or macronutrient?
Yeah, no, it is a micronutrient. The quantity that is required is very in smaller proportions. However, again, as I said, it is available in several food items. It is available in legumes. It is available in pulses. It is available in leafy greens. These are the very ones which are advised as a part of the diet. More the color in your food, the better it is going to be nutrient rich, right? And this folic acid, basically it is talked as a prenatal vitamin, specifically because several times when a woman conceives, Up until she is coming to the time when she would otherwise menstruate, she may not know that she's conceived, right? So if I get, say, pregnant at this time, maybe my period cycle is exactly 30 days from today. Till I miss my next period, I don't know that I'm pregnant. But this is almost, say, about 3 to 4 weeks into pregnancy already. So in this much time, the neural tube which happens to form for the baby is already in process, is already ready. So, it's important. That is why that this folic acid literature has to be right while you're thinking of pregnancy or trying to conceive. So if anybody consults us as a nutritionist, or if they go and speak to their gynecologist that they are thinking in terms of having a family, the doctor or the dietitian would advise them to start taking folic acid, because we never know when this will occur, right? It can occur in this cycle, can occur in the next cycle. So we don't want to miss that precious neural tube formation timing with correct folic acid nutrition.
Okay, so what about macronutrients? So we have spoken about now enough regarding micronutrient. What about macronutrient?
So when we talk of macronutrients, it is all about the carbohydrates, proteins, fats, and the fiber. And we should not miss water, but we don't call it as macronutrient. It is a very essential part of the entire diet. So macronutrients include all our carbohydrates, and our carbohydrate maximally comes from our cereal and pulse based meals, and it comes from fiber based coming from vegetables. So while we have in our country, we have several cereals and several pulses which can be utilized in different combinations, in different proportions. It is going to allow us to eat enough carbohydrate. While we look at proteins, that is where the challenge is, because India as such is more a carb dominated eating pattern. So while we try and calculate any meal or any person's diet, we will find that there is more carbohydrate. There may be good amount of fat as well, but there is often a deficiency of protein in diets. So here is where we have to start thinking in terms of that if my body is, say, at X kilograms. So if I'm giving an arbitrary figure, if I am weighing 60 kilograms today, my body will at least require zero point 0.6 grams per kilogram body weight of proteins as for normal nutrition for my normal being. So that is at least the minimum which I need to take as a prenatal timing, in the prenatal timing, as for fertility diet. So
Fertility, yes.
if I am trying to define a fertility diet, what will I include, right? So I will try and include a variety of cereals and pulses as combinations, because cereal and pulse, when they are taken as a combination, they will improve the total protein value. Also, I will try and see that I include proteins coming in from milk and milk products. If I am a non-vegetarian, then maybe from egg, some amount of chicken. I can also try and introduce fish, because that has got good quality proteins. Often I also advise them to try and use some pulses, maybe in the sprouted form, such that it is more digestible. So that will take care of overall protein requirements. And when I'm looking at fats, it is, people feel that fats are bad, but it's not that all fats are bad. There are some visible fats which we can limit the amount. For example, I will not take a lot of oil, or I will not take a lot of ghee, but at least 3 to 4 teaspoons in a day of either of the two, or a combination of two, is good to take. Why? Because these fats will allow the fat soluble vitamins to be absorbed in our body. So if I'm eating a lot of vitamins and they are not getting absorbed in the body, it is a waste to eat that, right? And when I'm saying the micronutrients are important and I'm consuming it, but it is still not available to the body just because I'm not eating the right amount of fat, it becomes a wrong kind of pattern. And that is why it is important to make sure that you are able to calculate a little around how and what you eat, and make sure that you're eating something which is satiating, something which is interesting. It should not become a boring diet, right? I mean, when
Yes,
I set my plate and I feel ye mujhe nahi khana hai, then I'm not really enjoying my food, right? And the
yes,
moment
it
I
should
don't
be
enjoy my
delicious.
food,
It should be delicious. It should be tasty also, right? Yeah.
exactly, because a fertility diet is something that you are actually waiting to get pregnant, right?
Yes,
So there
yes,
is a lot of joy that is in your mind around, like whenever you think that I'm going to get pregnant, there is that ullas that really comes in, right? So at
yes.
that time we are not sick, we
Mm.
are not wanting to eat something which we will think that we are sick, and that is why we are eating just that basic dahi chawal or basic those foods which are very small and very easily digestible, relishing. Here is there is a lot of charm that we are looking forward to. So fertility diet should create a lot of interest and should be able to a person should feel joyful and enjoy it to the best, and that is going to create a difference. So it's not all about the type and the quantity of food I eat, but it is also about how I think around the food while I eat it.
Mental state and the environment around that woman or couple, we can say, that decides a lot. So that reminds me the beautiful concept of Ayurved, which talks about, Saumanasya Garbhadharana. This is Sanskrit verse where we say that couple's state of mind is very important part to, have that, create that foundation for conception,
Yes, absolutely.
to boost that hormones, to boost that positive hormones in the body so that it can stimulate those bija, that is sperm and ovum, so that they can meet. Okay, so here you are saying fat is important, carb is important, and as in India, I can definitely understand that we eat a lot of carb because during my visit to UK recently, I found myself craving for this carbohydrate content diet because there we hardly used to have such a kind of food in which there is a carb and things, the quantity, the way we eat here in India, it is not the same in UK. So definitely we need to maintain balance. I think local where you stay, that matters. What kind of food you are taking from your birth, the from birth and during your growing up time, that also that is also important in order to decide your fertility. It's not just the you thought of having baby and then you visited gynecologist and you found that okay, there is some problem, and then you started working on yourself. So I have one case which is actually dealing with this particular problem, not
Okay.
conceiving. And then she did test, and there are a lot of problem which detected, like there is a ovarian failure, where that the quality of one means, now see, for conception we require one qualitative egg, and that egg is not able to getting from the intercourse or whatever things is happening. So then she tried a lot. She has even taken the consultation from best doctor, and they have given even the modification in diet. And what she shared with me is something where I felt like, oh my god, what are you doing, so she has been advised that eat a lot of eggs, you know take a lot of
Oh,
eggs. Every day egg should be there. You can eat one or two eggs, it is good. But then I feel like it's kind of over burden of protein, or the thing which one item if you are taking. Then she also shared with me that lot of the whole day there are some or other things. She is either eating lentil, she is either eating pulses or something. So I feel like when you plan for conception, before that, after 8 years of marriage, she thought of having baby. Before that, she was not ready for it. Now she wants it, and then she found that okay, there is some problem, and then she is bombarding her body with lots of food, lots of protein, lots of nutrient, whatever people say, she is just taking in. So I feel like here is the role of the right nutritionist like you, who can really guide them. Don't bombard. There is no need of bombarding, right? There is just need of having that nutritious food which will give you that one qualitative egg for
yes.
fertilization. So this was about my case. If you have any kind of history, just now I read some of your client, Kalami status someone. I don't know the name. You might be knowing. She has shared that she has taken, I think, treatment from you, the consultation for obesity, and also she found the result of even that is resulted in conception as well. So
Yes.
uh, there is a concept like trans fat का भी बहुत सारा obstruction होता है, बोलते हैं कि जिसको fertility चाहिए उन्होंने ट्रांस फैट वो अवॉइड करने चाहिए. सो व्हाट इज ऑल दिस अबाउट एंड हाउ यू डील विथ दिस?
So, when it is obesity, what happens is often the, the 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 way the egg is released at every cycle changes. So that is what we eventually learn as polycystic ovarian disease, and which is getting very very common. And lot of time it is because of insulin resistance also. So the moment you start losing some weight, anything around 5 to 10% of weight loss can create a difference in the way your body starts behaving, and the insulin sensitivity becomes better. And once this insulin sensitivity is bettered, automatically your cycles start coming better. Sometimes women don't menstruate at all for 1 month, 2 months, maybe 2 3 cycles they may miss, and then suddenly they may have one cycle proper. In such a case, how will you actually plan to have relation also, because you don't know whether the egg is going to be released or not released this month, right? So it is important to get these cycles also corrected, and that is also around like how you eat and the kind of activity you engage in, right? If you are able to understand the concept that whatever you eat will have some amount of calories, and whatever you are going to use in your activity is energy utilized. So if you are wanting to have a good balance in your weight, and if you are maybe overweight or obese, it is important to see that your energy expenditure goes higher than what is your energy intake, so that something from your stored fat, your stored energy from your body starts getting utilized, and you will slowly and gradually your metabolism becomes better, the insulin sensitivity becomes better, and you are able to lose some weight. So that is the way we start thinking around what to give, when to give, and with what activity to combine what kind of food, which is again important, right? If I'm doing a lot of difficult activity, probably if I'm running for 1 hour, taking a very wildest of example, that suddenly now I want to lose weight and I start on a activity regime, and I start thinking that आज से 1 घंटा मुझे भागना है. It's not humanly possible. If you will run for 5 minutes, you will start feeling tired. Why? Because first thing, you are not used to it. Second thing, because you are carrying your own body weight while you are running. So whatever weight is there is what you want to slowly and gradually reduce. So trying to take an activity which probably is not sustainable can make it difficult for you to follow and keep up to it. So it's important that you plan certain things very systematically and then abide by it. Like if I want to say start adding maybe 1 teaspoon of say dry fruit in my daily meals, or maybe 1 teaspoon of required amount of uh, khaskhas kharik in my meals to make a difference to what my body is going to get out of it. It is going to be a systematized way of making change. Now if I feel कि एक दिन मैं बैठ के पूरा खसखस का porridge खा लूंगी, and it's not like आज खाया तो पूरे हफ्ते के लिए चल जाएगा.
Yes,
Everything that it has to be on
should
certain
be
things are
discipline.
required.
Discipline, you mean to
Yeah,
say, right?
discipline. Correct. I cannot eat one whole packet of dry fruit today and then think pura week I will not eat now. That doesn't work. No, so while we are planning meals and while we think of fertility diet, this is again another thing. It has to be systematized, it has to be disciplined, it has to be sensibly planned. It should not be something which is not doable. Anything that is not doable is not sustainable. So then it
Yes.
doesn't give its own result. And
Mm.
often once you start, the first thing, when you think diet in itself is taboo. People feel diet means khana band karo, and that is exactly the very wrong connotation. So
Yes.
nowadays what I use is I use a meal pattern instead of a diet, so that it actually says what I am going to do. So while we are talking of fertility diet, I feel we are going to talk about fertility meal pattern, which will ensure that you start eating things right, not just the food items also, but thinking right, because thinking is food for your mind.
Yes.
And
Everything
thinking
starts
right,
here first.
exactly. Even the thought that you want to conceive starts here first, right?
Yes,
Starts here.
yes,
Why?
yes.
Because maybe several people would have given you some hints to it, maybe. And you may
Yes,
have now thought that, okay, it is time that I can decide. Maybe, I have taken my decisions, I have used my time profitably and whatever, I'm settled now and I want to plan for a family. But
yes,
sometimes, out and out, the number of people that I get, where fertility becomes an issue is where people have taken many more years to decide that now they want to conceive, right?
yes.
Usually we
That's what I
see,
told you that about that lady. After 8 years now, she is thinking when she is almost 35 year old, and now the quality of egg, as such, it is in degenerating mode.
yeah,
So
it will change, correct. But nevertheless, I have had so many women who have been able to even conceive at the age of 42 and 43. So up
yes,
until then, when you are really menstruating, there is still a possibility. And
yes,
that, people are not having surrogate babies, or not that people are not adopting babies. But if you really want to experience motherhood, then you have to, make your body ready to experience motherhood, right? So
yes.
that is an in thing, and that can happen only with having the right discipline, trying to, do the right lifestyle modification, which will call for this, which will include your body, which will include your mind, as well as
where
to
I
the
can
level.
where I
Ah,
can say that yoga comes into the picture. So yoga and nutrition both needs to be integrated here. To bring discipline, it is very difficult, and particularly for human being, right? Yeah. So we have
I
some
saw one
students who
question
have
here.
joined us. Yeah,
I
yeah,
saw
yeah,
one question
Meera.
for Dr.
So
Nutan.
they are some students from our pregnancy nutrition and prenatal course. So Meera asked earlier that are dairy products safe or suggested for conception? So from my end, definitely, means the Ayurvedic point of view, Ayurvedic perspective. It's important that if you are used to take this dairy product from your childhood, and if your body is okay with okay with it and digesting it comfortably, then it is important. In fact, in Ayurveda, milk and milk product has been given a lot of importance for fertility and even during pregnancy. So now let's hear from Swati ji what modern science says about
Yeah.
it.
So when we look at modern science, Mira, it is that while we are looking at milk, we are looking at milk in three different ways. One is, of course, that it is a liquid and it is necessary that our hydration stays well. It is a liquid which will have some energy, right? When I'm only drinking water, then there is no energy coming in. But there are times where, I am tired and probably I want to take something which energizes and which is not very difficult for me to manage. Milk can be a source. Third thing, I'm looking at milk, probably also that it can combine with so many different things, right? Milk can be used with maybe, a fruit, which often I, say that eat fruit and milk separately. However, that has been a very huge combination that we follow in India. But milk combines with all your cereals. It can go with some other combinations, as your porridges with different cereals, with milk as combination with dry fruits, milk in combination with your dals, like making some kind of porridge out of dal based products. So these kind of combinations have worked. So I feel that if we want to include milk, there is no taboo. But in a fertility diet, I wouldn't say drink 1 liter of milk. People feel कि बहुत दूध पीने से you will immediately start getting fertile. That is not the thing that will really happen. Milk has to be used in proportions which your body can manage. And milk need not be just like milk in itself. It can be as milk products. And the question did say so. So milk products can be like, your curd, buttermilk, maybe you can use paneer. So all these will be varieties which can be a part of your diet at different points in time. And we don't want to eat monotonously the same item, right? I don't want to drink 1 liter of milk every day in and out till I conceive, right? I want to enjoy milk in different forms. So that should be a possibility. So one day, if you're taking 2 glasses of milk, probably the next day you can use milk in a different way. Make use of some cheese. The third day you can make food item, or
So
maybe
you
sabzi
can
out
say
of
it's a
paneer
different
base.
different recipe, right?
You
Like
know,
panchamrut or curd or buttermilk. In the form of that, you cannot drink every day that glass of milk, plain milk. So you can just make it in a different form, or add some things which can give you that taste. right? Yeah.
correct. So it
Uh,
shouldn't be that you're adding too much sugar and having
huh.
this milk,
Yes.
because the
Yes. Yes.
value of milk has its own, I mean, it is potent in itself. So trying to, change the composition in forms of adding more carbohydrate, which is simple sugar, can be avoided, because that
Yes.
can change the way you are able to consume milk. Because if I have sweetened milk, I can take a lot of it. Maybe, ice
Okay.
cream, Shrikand,
Yes.
all our
That is
ways of
already
having
sweetened. Yes.
milk in the form with a lot of sweet. So probably
Yes.
that I not encourage, but otherwise milk in various different forms is a very healthy way of bringing around nutrient value in your food, in your
Yes.
entire meal.
Yes. So it's almost 30 minutes, so we don't understand so much time, we just pass when we start, talking about this particular subject. Okay, there is last question, which is
Yeah.
there in the comment. If you can read it. Which test help in diagnosis of selenium zinc deficiency?
So normally, what happens is, I don't know, Smita is the name I see here.
Smita,
Usually,
Smita.
usually, these kind of tests, normally people don't go and do and try and find out whether there is a selenium deficiency, right? However, selenium is one nutrient which is necessary for, bringing about joy. Why? Because this is a part of
Happy, happy, happy nutrient.
yeah, it is one which is going to bring about happiness hormones and influence the creation of happiness hormones in your body system, right? So if even a small amount, very small amount, it would be as little as point something. If it is that much also is present, usually we try and see anything around 40 to 60 micrograms is given in a pregnancy diet. But when I'm trying to plan something around a pre-pregnancy, right, while we are looking at a fertility diet, even that amount, if I plan in this diet, will come from nuts, from oil seeds. So if I'm able to take, maybe 3 or 4 nuts in a day, and if I am maybe almonds or walnuts, and if I'm able to take maybe 1 teaspoon of either til or flax or a combination of mixed seeds, it is going to bring about that much selenium that my body is going to require. So no, it's not huge, like ऐसा वाटी कटोरी या आधा किलो में नहीं कुछ खाना है. It's more about taking these nutrients, but on a daily day basis. That is the crux.
Okay,
Right?
she asked about how to diagnose that deficiency. Means such
So
a is
I,
there any
I
test?
I don't know the name of the test here. Maybe we'll have to find out. But there may be a systematized diagnosis which happens in the laboratories. But I have not heard people going and trying to find out whether they have a zinc deficiency,
Yes,
because
yes.
it's not
We
a
are
very
saying it.
common thing. Yeah, but
Yes,
there are symptoms which you will be able to recognize that probably it is deficient. Trying to have some kind of muscle weakness, some jittery things happening in your what do you say, soft tissues. These are certain things which may be common, but not very easily found. So that is why, while we are eating a very systematized planned diet, it does not lead to any kind of micronutrient deficiency as such. So that's why, when we say pregnancy nutrition or pre-pregnancy nutrition now, in the way and the quantity that you eat, and you will be sure that you will not land up into any of these deficiencies.
yes, yes. So it's a wonderful talk, Swati ji. So let's summarize now whatever we have spoken so far. For the people who have joined late, they may watch this recording later on.
Yes.
But to here, just to mention, we have spoken about what is exactly fertility nutrition is all about, and how women can prepare herself starting from thinking about first conception. And it's not about only women, but the couple actually needs to plan and focus on their whole health. And obviously food
That's
plays very
right.
important role in all the things. So but it's not about what you eat, it's about how you digest it. And to digest that, you need to have a calm, quiet state of mind, healthy environment around you. There should not be any stress, right? there should not be any kind of disturbance in the process of preparation for the pregnancy. Then we focused on what are those macronutrient, what is micronutrient, and how someone can understand which vitamin is important, what are those important vitamin and nutrient needed for fertility. That also we have discussed. And then obesity related points, fats, carb, how they are important. So these are the points which we have definitely covered in small this time. So I think we have next episode as well, so we can keep some discussion, to continue further in part 2 or episode 2, which will be there in next week, I guess, right? On 8th
Yes.
of
We will
December.
again go live. Yeah. Next
To be
week, exactly.
continued.